And here we are again at Med School Radio. We are about to go live for a question on hepatoblastoma, an MCQ from osmosis.org. So let's go ahead and go live, and we're going to start this podcast. So welcome everyone. We are live here podcast at Spreaker, also on Instagram. We're going to look at a question on hepatoblastoma from osmosis. So let's get right to it. A 2-year-old boy comes to the clinic because he hasn't been eating well for the past 2 weeks. His mother says that he has been sleeping much more lately and that he seems to get full after eating only a few bites of food. He has not traveled recently and he has had no sick contacts. Family history is significant for a total colectomy in his father when he was 16 years old. His 12-year-old first cousin has started getting yearly flexible sigmoidoscopies. His temperature is 38.1, pulse 86, respirations are 22, and his blood pressure is 108/66. Physical examination shows a large palpable mass in the right upper quadrant of the abdomen. And laboratory studies show an elevated alpha fetoprotein level. An abdominal computed tomography scan is performed as shown below. You can't see this, but the scan, I'm going to try and turn this around on, I don't know if anyone can see this on Instagram, but here is the scan. I'm going to turn this around and we're going to continue with the MCQ. So there is the question stem, and we're going to have to think about the most likely diagnosis here. And the choices are A, Burkitt lymphoma, B, gallbladder adenocarcinoma, C, hepatoblastoma. Maybe you can guess it's that one because that's the subject of this conversation. D, pyloric stenosis, or E, Wilms tumor. So the answer, as you know, is hepatoblastoma. But the major takeaway here is that hepatoblastoma is a primitive tumor that is the most common primary liver tumor in young children, occurring most often before the age of 5. They occur much more often in children who suffer from Beckwith-Wiedemann syndrome and familial adenomatous polyposis, and screening may be regularly carried out in these conditions. So what if you had thought that it was Burkitt lymphoma? Burkitt lymphoma is a B-cell lymphoma caused by a T814 translocation involving the CMYC gene and immunoglobulin heavy chain locus. In the sporadic form, it may present as a mass in the abdomen or pelvis that doubles in size each day. So perhaps you had thought it was a gallbladder adenocarcinoma. Gallbladder adenocarcinoma mostly presents in the elderly population and is often asymptomatic until it has progressed to a clinically unfavorable stage, and it often results from unrelenting irritation of the gallbladder mucosa from gallstones. So continuing on, let's look at the main explanation here, and I'm glad to see we have some people who joined us. Hepatoblastoma is a primitive tumor that is the most common primary liver tumor in young children, occurring most often before the age of 5. Typically, the rest of the child's liver is perfectly normal. These tumors are thought to arise from pluripotent stem cells and thus have the ability to form many types of tissues within the mass. Hepatoblastomas occur much more often in children who suffer from Beckwith-Wiedemann syndrome and familial adenomatous polyposis, or FAP, and thus screening for this malignancy may be regularly carried out in these conditions. Remember that alpha fetoprotein levels are usually elevated in children with this tumor. This can be remembered by the fact that alpha fetoprotein is thought to be the fetal version of albumin, and thus is produced in large quantities by the fetal liver. If the tumor is completely resectable, removal with adjuvant chemotherapy results in 100% survival. However, as some of the tumors invade into other tissues, some forms of hepatoblastoma have poorer prognosis. So there we have it, the answer from osmosis.org. Thanks for tuning in, and thanks for everyone who is tuning in on Instagram too. I'll be back with another live broadcast for Med School Radio. Thanks very much.